Archie Clements, who joins us now from Perth, Australia. He's a professor at the Faculty of Health at Curtin University. Thank you so much for joining us on the program. Now, there's been a lot of conflicting reports on Trump's health condition, and this latest development on him taking dexamethasone adds to the confusion. Now, according to medical experts, and you would know yourself, it's quite normal to be taking remdesivir in the early stage of having the virus, which his physician already said he was taking. But how normal is it for him to be taking dexamethasone now?
Well, dexamethasone obviously is an anti-inflammatory drug. It's used to counteract the damage that the virus causes to the lungs. And typically, as you've reported, it's used when someone is in a severe stage of illness. So it's to limit the amount of damage that the virus is doing. So it's not very clear to me whether or not the President of the United States is receiving a standard level of care for coronavirus, or whether they're doing some kind of enhanced care, which may be providing him with drugs at an earlier stage than they may somebody else. I guess the issue with that is whether or not that sort of approach would be considered to be evidence-based. My thinking would be if the physicians are utilising evidence, then that would suggest to me that his illness is pretty severe, because that drug is only used when the disease is severe.
So you don't think he has mild symptoms, as his physicians have been telling us?
Well, as with anything that relates to Donald Trump, it's hard to tease out the fact from the fiction. I think one of the issues with the progression of the coronavirus disease is that you can appear to be well, or you can appear to improve, and then very quickly your health can deteriorate. So it's all the progression of the disease is a bit like a roller coaster. Sometimes you're up, sometimes you're down. So I think it's very difficult to tell really difficult to tell at this stage.
Right. Now, Professor, now that he's got the virus, what do you think Donald Trump's action plan should be in tackling COVID-19 from this point on?
Well, I think first and foremost, he should be trying to lead by, good example, which means that he should be practicing, proper care of himself, not exposing other people unnecessarily to being infected from him or from anybody else. He should be encouraging everybody else to follow health advice. He needs to lead by example. Not following health advice himself is not exactly a good example to set for other people. Once he does recover, he says that he's now can talk from experience, having had the virus. If he's, it seems that he's at this stage that he's lucky, and that he's, that he's not, currently in intensive care. He's not currently on a ventilator. Hopefully, he will be able to sympathise and understand that his experience of the virus is quite different to everybody else, or to many other people's experience of the virus. So it really depends on his behaviour.
All right, Professor Archie Clements, thank you so much for joining us on the program today on TRT World.